Hello everybody. In this video we want to look at a previous year question. Look at this. For 3 marks it has been asked, only 3 marks. They have asked, mention the boundaries and contents of quadrangular space. Some quadrangular space. So what do you mean quadrangular? Some 4 boundaries will be there, right? Some quadrangular space. As it has come in anatomy question paper, we know it is some anatomy. But what do you mean by quadrangle? Quadrangle. That means, what is quadrangle? Anything which has 4 sides, right? Straight lines, they will be mostly. And when you search quadrangular space, it always points to upper limb only. So interestingly, we don't have any other quadrangular space in our body. Okay. So meet Mr. Human here, who we will turn and look at his back. Here we are, the right shoulder from behind. We're going to remove the deltoid. So now look at this, how it looks. Where are we? Okay. Now we removed the deltoid and we are zooming here, and somewhere here, can you see a quadrangular space? See here, there's a quadrangular space. Wait. Quadrangular space is there here. Okay, this is the quadrangular space. So inside this, what can you see? Some blood vessels and some nerve, correct? So they're asking you this spaces, boundaries and contents, I think, right? So boundaries and contents only they are asking. So no need to draw diagram because it's only 3 marks. So now let us look at the boundaries and contents. See, contents is very easy. So look at the contents, okay? So what do you have here? Some nerve. What nerve is this? Axillary nerve. Okay, very good. Then axillary nerve over. Then there is some blood vessel, humeral artery, and it is circumflex. It's going around the humerus, right? So it is right circumflex, humeral artery, and now a vein which is coming from the humerus and draining it out. That is the right circumflex humeral vein, again posterior. They have labeled it as posterior. So posterior humeral circumflex artery, posterior circumflex humeral artery, posterior circumflex humeral vein, and one nerve is there. Which nerve? Axillary nerve. Okay, so you have to remember blood vessels and nerve. So we are done with the contents. If you just write this much, you will get 1.5 mark or half mark. No, so wait, 3 marks, right? So they'll give 1 mark for this and 2 marks for this, I'm thinking. So you just write axillary nerve and posterior circumflex humeral vessels, you should get 1 mark. Okay. Now coming to boundaries. Boundaries means something like this, right? So what did you see so far? Did you observe anything? What is there here? Here it's nothing but the humerus on the lateral side. On the lateral side, it's the humerus. On top, you have the teres minor, right? Bottom, you have the teres major. I'm not sure why minor is coming up and major is coming down. And on the medial side, you have the triceps. Okay. Triceps brachii. This much you remember. On this, we will develop more. Okay. So here you can see teres minor. Here, this one below here is teres major. On this side, you have the humerus. Lateral side is humerus. And medial side is the triceps. Triceps. But we all know this much information is not enough, right? We need to give more information. So let's look at this. Superiorly, you have the inferior border of the teres minor. Inferiorly, you have the superior border of the teres major. Yeah. And then medially, you have the lateral border of the triceps. And laterally, you have the medial border of humerus, I would say. But actually, it is surgical neck of humerus. Still not enough for the exam. You need to write little more. What is it? Okay. So it is going to be inferior border of teres minor is correct, superior border of teres major is correct, lateral border of tricep is correct, but you should say long head of the tricep brachii, and laterally you have the surgical neck of humerus. Superiorly, two more things they are saying: subscapularis muscle and capsule of shoulder joint. Okay, Mr. Human, please turn. So superiorly, what and all extra we added now? Shoulder joint and subscapularis muscle. Okay, it will be in front of the scapula, on anterior side of scapula. Okay, subscapularis muscle. Okay, so now when you go back here, subscapularis, superiorly what do we have? Three things. Subscapularis, capsule of shoulder joint. It is capsule of shoulder joint. Okay, not just shoulder joint. Then inferior border of teres minor behind. Okay, so teres minor is behind, it seems. Did you observe that? Teres minor is behind or what? Teres minor is, okay. Anteriorly, when you're talking from anterior, if you're talking, teres minor is at the back. Oh, yeah. Okay. Then, just see how it overlaps. Teres major, then long head of tricep and humerus. Okay, first teres major you have to draw something like this. Then you have to draw tricep, and then you have to draw humerus, and then over all this will be the teres minor. Teres minor is at the back. That's why they have used the word behind or what. So here we're trying to draw the quadrangular space. Okay, this one, quadrangular space we're trying to draw. So it's there somewhere here, right? So we need to show what and all? Humerus. Then we need to show one teres major going like this. Then we need to show a long head of triceps going like this, and a teres minor going like this. So we are done with the quadrangular shape. Okay. So what and all you have here? Quadrangular. Here you have humerus. Right? What do you have here? Humerus medially. Laterally you have humerus. Medially you have the long head of triceps. Superiorly you have teres minor, and inferiorly you have teres major. Content what you have? One axillary nerve, right? One axillary nerve, and then you have some circumflex humeral vein and artery. Okay. Vein and artery. Posterior circumflex humeral vein and artery. Okay. Axillary nerves. And so these three are the contents. Three contents, four borders. Superiorly you have something more. Capsule of shoulder joint and subscapularis muscle. Okay. In front of the scapula. So superiorly what only you have? Subscapularis, capsule of shoulder joint, and behind all this you have the teres minor. Okay. So superior border is inferior border of teres minor, remember. Okay.